we have with us Marisa, and Marisa graduated from the program almost a year ago. So this is a 1-year post-program follow-up. So I'm excited. Welcome, Marisa. Let's have you introduce yourself. Tell us a little bit about um, who you are, what prompted you to join the program a year ago.
Wow, so my name is Marisa Chaco. I'm out of Austin, Texas. I joined the program a year ago after getting my official diagnosis of Hashimoto's. We have a cousin that was in your program and was telling me all of the good stuff and how much it was helping her. And she, I think, was right in the middle of it at the time. And so I got on a call with you and we talked about it and we went through all my symptoms and everything that I was having, which was textbook Hashimoto's, and the work started then.
Well, Hashimoto, one of the things I teach Hashimoto's that's big, that it is a huge hormonal autoimmune disease. So it's not just your thyroid that's under autoimmune attack. Doctors treating Hashis and people with autoimmune disease don't even understand how much other hormone making organs like your ovaries, your adrenals, your brain hormones, your pancreas, which makes insulin, how all these systems are also under autoimmune attack frequently and usually in dealing with Hashimoto's. So what were some of your outcomes immediately after the end of the program, working with us online after 2 months? What were some of your immediate outcomes a year ago?
Oh gosh, immediately joint pain went away. Inflammation started to go down immediately. I think I lost like 15 pounds of just inflammation. Yeah, you can, I mean, I've always had kind of chubby cheeks, but it was, I was just looking back at pictures recently and I can't even imagine, like, I can't believe like how fat my face was because it was just all the inflammation that was there and it was just all over.
So you felt like in the first 3 months, you lost a lot of inflammation, weight, and joint pain. Where was it before the program and was it just 2 months later? 0 out of 10.
Gosh, 8.
Okay.
Yeah.
The end of the program?
Gone.
Okay, 0.
Yeah.
Okay, Marisa, people think that's not possible.
No.
I mean, besides Hashimoto's, did you have a diagnosis that accounted for the pain, or one of those mystery people that had tons of other symptoms and no other diagnoses?
Yeah, I had tons of other symptoms and just kind of never knew about it. I mean, when I was 19, they had found a goiter on my thyroid and I had gone to one of the best endocrinologists in Austin at the time. And he said I was borderline Hashimoto's. And of course, now we know there is no borderline. And so we would just kind of monitor thyroid levels, just the basic, whatever, you know, TSH that they do every 6 months since I was 19 until I was 39. And they found it like the one time they monitored it and it was not in range, as so they said. And then we kind of started going from there, but I had already biopsies done on the goiters and things like that. And they're like, we'll just watch it. We'll just watch it.
So funny. What are they for finding the cancer? And that's the thing that bothers me about goiters is that they're actually a reaction to autoimmune attack. So here's the deal. If you do nothing to calm the autoimmune attack, they're just going to get bigger and bigger, more and more numbers, and they become higher and higher risk to become cancer. And this is the reason why people with Hashimoto's are such higher risk for thyroid. So, you know, I have Hashimoto's as well. And that was one of the things for me. It's like, no, I'm not going to sit here and watch and wait while I and other people are just waiting here sitting ducks to get cancer.
Yeah.
That makes 0 sense.
No, for sure. And that's, you know, kind of before I met you in the program, I had just had a thyroidectomy, partial thyroidectomy, because the goiters were so big, I couldn't swallow. They did the genetic testing on it and it was inconclusive if it was cancer or not. And so thankfully, I mean, I know I want to have surgery for something like that can be preventable, but at that point, I'm glad that it's out and I don't have to worry about it and I don't have to deal with cancer, you know?
The half of your thyroid that was removed.
Half of it, yes.
But here's the deal, is removing an organ doesn't remove the underlying autoimmune attack. That doesn't mean that the risk for the rest of your thyroid that's there, that didn't balance your thyroid hormones, first of all. Second of all, that didn't remove the risk of the rest of your thyroid getting cysts, goiters, or thyroid cancer if you didn't stop the autoimmune attack. Am I right?
Right, you're absolutely right.
So I have a question. We're a year out now. And so my question is, you probably have had ultrasounds, you've had doctor's visits looking at the rest of your thyroid. My question, after the program, I'm curious, you haven't told me this, and I'm just asking this question right now. What's happened to the rest of the thyroid as far as any cysts, goiters, or nodules in there?
Nothing, there's nothing, it's good, it's clean.
Nothing. So no new lesions.
No new lesions, no new lesions. I haven't had another ultrasound because I haven't had any issues, since then. We've been monitoring, antibodies to see kind of where my Hashimoto's is. And I went from 695, which was the antibodies when I was diagnosed, and I'm at 15 right now. So.
Well, and Marisa, I mean, people want to know, inquiry minds want to know, a year after you finish the program, what has happened since? Because we do 90% of our interviews are at the end of just 2 months. And now I like showing people, well, where are you now a year later? What has since a year ago, what has since changed, continued to change for you, for better or for worse? We're curious.
Yeah, I mean, my hair is coming back, thankfully, with the help of some supplements, of course, and diet. Still working with a nutritionist on diet and hormone balancing, which is kind of always, right? I mean, just the diet changes that I've been doing for myself, and my husband eats dinner with me, and my mom's lost like 40 pounds since she's moved out because yeah, she's gotten off some of her diabetes medicine, and yeah, I mean, it's helped all the way around.
So Marisa, I talk about this where when I call us the filter generation, which is when you do this, not only are you helping the generation below you, which are your children, but the generation above you are that autoimmune mess as well. And so you're a classic example. So mom lost 40 pounds and went way down on her diabetes meds just by doing what you were doing.
Yes, yeah.
And most people don't even know diabetes is an autoimmune disease. I bet you didn't even know that before the program.
I didn't, no. And as soon as I learned that, I came home and I was like, hey guys, you all have, autoimmune issues now. like follow me. We'll do this together.
I love it. Okay, so tell me results wise, where are you now? What are 3 top results or 4 results you have right now that a year ago didn't even exist?
Wow. My anxiety has gone down. That was one of my huge, it just kind of came out of nowhere. I've never had any anxiety issues, and granted, it was a stressful time. And then when I found out my hormones were all out of whack and Hashimoto's, and I mean, I was having panic attacks on the way home from work, which now I is blood sugar levels not being balanced. Yeah.
Insulin, pancreas, insulin levels, and hormones and thyroid are all
Yes. Yeah.
causing anxiety.
Yes. Yeah. I mean, my hair was falling out. I wasn't completely bald, thankfully, but I had lots of hair. That's growing back. You can see how long it is.
It's
just my energy. Yeah. Just energy level. I mean, I was so exhausted by the end of the days. I mean, there was mornings that I couldn't even peel myself out of bed to go to work and sit there at work all day. Like I was just, I was barely making it. And now, I mean, with diet and my supplements that I'm helping, my vitamin D helps, kind of everything get balanced out with everything else. We've got 2 brand new puppies that I can keep up with. I can outdo the housework
How important was the role of having your own data and understanding your data and your hormones?
Oh my gosh, huge. Huge. Like I can't, that's the only way, I mean, I feel like that's the only way to move ahead, is having that data and knowing exactly what you need to do, what you need to work on. Focusing on what's going right instead of what's going wrong, and what you can have instead of what you can't have. Once upon a time.
Curious, people want to know, what did your data show you was wrong? What did you learn about your own data and your own body?
Yeah. Well, the iron, the anemia one was like mind blown on that one. When you talked about, you know, the MCV levels and checking your B12 levels and kind of how they all, you know, go together with your ferritin. So one number can look right, but the others can be off, or two can look right and one can be off and you're still low. All of that, like really learning that, and because I've struggled with anemia all my life. And now, I mean, obviously I had, you know, 2 periods a year, a month for how many years?
Is your anemia gone?
Almost.
That's great. That's part of your energy coming back, is the anemia getting finally resolved. It helps when you don't bleed to death twice a month, right? Or most of the month.
No. And a lot of the times now, like, I feel like my period sneaks up on me. I'm like, oh wait, I wasn't ready for you. I don't have any symptoms.
It's so light and so easy.
Yeah.
Awesome. Okay, that's it. That was awesome. You know, hi, I hope you enjoyed that interview with Marisa as much as I did, and see what a great example of what I tell people, which is that we're a 2-month online program that launches people into a year of autoimmune turnaround. And see, look at where she is a year later. And it's continued work and diligence based on the data and the education she had during the program, but also continue practice. And not only is she seeing results, her mother has lost 4 pounds and has dropped her diabetes meds like crazy. Her husband is also aligned with her, supporting her and doing those health changes. And she's seeing more energy, and their relationship has completely changed. And her view of herself, her own relationship with herself, has been metamorphosized. So thank you so much for joining us. And if you enjoyed this, I hope you can share this with anybody else that you think could benefit from learning about autoimmunity. Have a great day, everybody.
Lupus, lung fibrosis,
Hashimoto's thyroiditis,
fibromyalgia, AS, which is a form of arthritis,
that's too far, extremely fatigued,
pretty much zero joint pain.
Much more happy.
I don't have brain fog anymore, how much weight I have lost.
I want to see remission.
Maggie and her approach is very different than the traditional doctor.
I'm a totally different person.
I got a better understanding of what those intolerances were.
You're not alone.
The community is, I'm learning from everyone else's issues.
It's not just helped me, it's helped my entire family.
We are transformed.
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 Join the movement and transform your autoimmune naturally today.